Hi, class. We are over halfway done with law and ethics, and um, we are moving on to some topics on boundary crossing and just your own professional competency. Hopefully, I feel like you've hopefully been able to take in some of what you're learning through lecture, through the different reading, through the discussion boards, just thought-provoking questions that you're asking yourself, uh, as well as seeing how you would handle certain situations. I know we're looking at it through the lens on the outside, and it's easier to make certain judgments when you're not on the inside, but I think it's good for us to think critically and think about situations that could come up. Right now I wanted to focus on just some boundary things, and our world as clinicians can become very small, and depending on the kind of setting you plan on working in. Some of you want to work maybe in a broader kind of spectrum with maybe a specific clientele. And so you won't really come across a lot of people that you know. Others of you might live in smaller communities. Maybe you want to work in your churches. Maybe work with a very specific population that's not, that would cause you to run into people, like in a school setting even. If you work in a school district where your kids attend school, you may end up dealing with children that your kids are friends with, or parents that you know, or things of that nature. And so it's important that we're mindful of where our paths cross and where our boundaries are. I've had situations where it's been very uncomfortable for me, due to the fact that I said yes maybe to someone and I probably should have said no, just due to how our paths would cross. And so, it just creates for awkward situations, and you want to make sure that you feel comfortable to be a human being, to be yourself in situations where you should be able to be yourself because you're not a therapist all the time. And you also are allowed to be a person who's not perfect or um, has needs, and you obviously don't want that to be with your client. Not that your client can't know that you're a human being, but just, it's not about you in session, it's about your client. So these are some good questions that uh, that maybe might challenge you as a practitioner, to make good decisions about maybe people that you could end up having multiple relationships with. Like, for example, if it's someone, a client comes to you, maybe, some of us have large churches, right? So you could get a client from your church, not even realize they go to your church. And then, of course, once they start seeing you, then now you see them everywhere. It's kind of like that car that you get. I remember I got a Toyota Echo years ago, and I'd never seen them. Well, I mean, I saw them on the road, but I'd never seen one like mine, right? It was a big deal. Anyhow, and then I got mine, and then I started seeing them everywhere. It's just how it goes. We have a gray Honda Accord. I swear there's gray Honda Accords everywhere. So just something to kind of think about when you put yourself in situations, what might occur. So is entering into a relationship in addition to the professional one necessary, or should I avoid it? So is it necessary that I meet with this person? If you are a small town therapist and there's not a lot of options, it may feel necessary, even though this person works at the salon where you get your hair done. You know what I mean? Or this person is a parent of one of your kids' friends, but you've never met them, or something. Like something where it's like, maybe it wasn't purposeful. Maybe it's like, I am the only person. But can I avoid this situation, or can I not? Can the multiple relationship potentially cause harm to the client? Is this going to be issues for the client? Me seeing this person. If harm is unlikely, would the additional relationship prove beneficial? If it's beneficial, is the benefit focused more on the client, the counselor, or both? So is it beneficial because you're getting something free out of it? Like, because that's a problem. Now, if you lived in a really small community, like Little House on the Prairie status, and the mercantile gave you items for you giving them chickens, like, Sure, but like there's not a lot of situations like that in the United States, okay? Now, if maybe you're in a third world country, that might work that way, but not usually here. Usually there's an exchange of resources like money, okay? Um, and we'd want if there is a mutual benefit, we'd want it to be more for the client than it is for you. Is there a risk that the multiple relationship could disrupt the therapeutic relationship? Is the person not going to be fully honest with you because they know they're going to see you in another setting? Can I be objective? Is my vision going to be clouded by knowing this person in a different kind of way? Okay. These are good questions to ask yourself. Good questions to ask yourself. Going on is that, to increase the likelihood that a client's we're checking to make sure we're serving the client's best interest. The therapist needs to be motivated by what the client needs rather by his or her own needs, right? Because this is about our clients, not about ourselves. The boundary crossing is consistent with the client's treatment plan, so it makes sense for what the goals are. History, values, culture, and diagnosis have been considered before we make a step. The reason for the boundary crossing is documented and recorded. So I may know this person in this kind of way. We've discussed the situation, blah, 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 blah. You want to document that. The boundary crossing is discussed with the client in advance to prevent misunderstandings. And full recognition is given to the power differential and the client's trust is safeguarded. Making sure you consult and make sure if you're under supervision, you're getting permission from your supervisor before moving forward in this kind of situation, I think is important. The main thing is we don't want to be harmful to our clients, right? And also we don't want to create a situation that's going to make it uncomfortable for us in our everyday lives. So we just want to make sure whatever decisions we're making, it's one in the client's best interest and in our best interest, right? Like you don't want to feel uncomfortable or awkward or strange in your everyday life due to taking on a situation that maybe you could have said no to and passed on to somebody else. You're not the one and only, Now, if you're in a small community, that could be the case. And so it's navigating that. But the one thing nowadays is for a lot of smaller communities with virtual therapy, not saying everybody likes virtual, but with virtual therapy, you could see a therapist that's miles and miles away despite being where you are. So there's definitely options. And it's nice to know that there is some. But again, like, you make these decisions, you want to make sure that it's beneficial for everyone. Now, as a clinician, you may have opportunities or may have situations arise where clients give you gifts. And this isn't necessarily something that is a legal issue, but it could be an ethical dilemma. Now, the things to take into consideration when a client gives you a gift is, one, is it appropriate for the situation, right? Like I have clients who, it's Christmas time, they go to the dollar store and they pick me out something. Like it would be very offensive for me to be like, no, I don't want this. Sorry, it's a boundary issue. They're like out of the kindness of their hearts. It's like they're grateful. They want to thank me, or they give me Christmas cards or whatever. I've had clients who are very kind and have, like in times where I've been pregnant, which has been a lot over the past 10 years of my life, have like seen me pregnant and brought me a baby gift, not anything like I've asked. That's just something that they've done. And so I'm not saying like you should receive all your gifts from your clients, and you need to talk to your supervisor about what's appropriate, what's not appropriate at your facility, things of that nature. Sometimes gift giving is very cultural. When you look at like, there's certain clients that we work with that are like from an Asian background, and it's like part of their culture to give a gift or to be kind in that kind of way. And so I would not necessarily want to insult them by not taking something, but I think it's just kind of knowing your client, knowing what they're about, knowing their intentions. Is it appropriate? Is it not appropriate? The kind of gift. Now, I want to talk about sexual relationships with clients, which one should never happen. We can't have sex with our clients. And if you do want to have sex with a client, you need to wait till 2 years from the ending of your therapeutic relationship before you can have any sort of communication with them that isn't therapeutic. So once 2 years have gone, after you've like stopped therapy, you can have 2 years and you could be a friend with the client, you could date a client, you could have sex with the client, assuming it's mutual, right? You could do all those things, right? But you have to wait 2 years. If you have a sexual relationship with a client, it is illegal and you can get in big trouble. Okay. Now, if you have a client that comes to you and says, hey, I had sex with my former therapist, there's a pamphlet you can give. There's a sample of that pamphlet in your learning activities. And you give that to your person and you tell them, like, hey, this is up to you, what you want to do with it. It's not something we have to call the police about or do anything about. We give them the pamphlet, and in the pamphlet, they're given instructions on how to handle the situation if they so choose. But therapy should never include sex. Okay, now attraction is very possible. We're human beings. You can be attracted to a lot of different people, and there's nothing wrong with that. But being sure that you are being mindful of any attraction that you feel, that you're talking to a supervisor about it, that you're talking to people about it, colleagues, so that one, you have accountability and that you're making sure that you're making decisions for your client and not for any of your own best interest. We're human beings. There's going to be people that are very attractive that possibly come into your office, but you can be around people who are attractive and not necessarily do something that's inappropriate, right? And so it's trying to navigate that. Now, if you have a client who's attracted to you and is making comments about that, just making sure that you're being very clear with them that it's not appropriate, and that, you know, letting them know the boundary. Because we talked a little bit before about boundary crossings, but we don't want boundary violations, and having sex with a client would be a boundary violation, which is not, you know, good at all, because that's how you lose your license. Now, you know, a lot of my clients, my male clients, like, I never touch at all. Now, I may have some female clients that give me a hug or something. Some I've known for years, you know, to play it safe, you could have no touching, handshaking, fine, you know, whatever. That's usually how I introduce myself to all new clients. I say, hey, you know, whatever. COVID really helped with that because nobody wanted to touch anybody. It was like elbows, right? Because nobody wanted germs, which made it very convenient. But I don't have instances where I need to hug or touch anybody, nor do I want to. Like, I mean, that sounds maybe mean. I'm not that person with my clients. Like, hey, how's it going? Let me open the door. I let them walk out. Like, we don't need to have some physical touch exchange. So probably having that boundary is safer than having it be murky or cloudy. Now, some of my kid clients could like give me a side hug, but you know, it's always that good church hug where it's like the nice like side hug, pat, you know, bodies aren't touching. It's friendly, but it's appropriate. You know, you just want to make sure you're trying to protect yourself, you know, and the best way you can protect yourself is being very mindful of what you're doing, being very much the same with everybody, and being very, you know, clear on what the expectations are. If someone makes you feel uncomfortable, you should never be uncomfortable in a room with a client. If you feel like a client is like creepy or making you feel uncomfortable in any type of way, or is making you feel trapped or anything, I would talk to your supervisor about it and don't be in a room with that person. Or maybe we have to navigate something else, you know. I had, you know, people have different issues, and like, you're not trying to be an experiment for someone, okay? And so maybe somebody else would be a better fit, or a different gender, or things of that nature, right? So you got to protect yourself, but we have to protect our clients. And with all this said, attraction is normal. Like, you see all these people on the planet. Just because you're attracted to someone doesn't mean you're gonna have sex with them. So just making sure you're very aware of yourself, what you're doing, and whose best interest is it in. And as long as you're answering rightly to those questions, then you're probably not going to have a problem. If you're like, man, I really can't concentrate on there. This person is that good looking. I feel like we have a lot in common. We jive too well. I just can't. Okay, well, then we need to talk about with supervisor to figure out an appropriate way to find the right solution for the problem. Okay. So it's very easy to be like, oh, I would never. But I don't know. Have you ever sat in a room for an hour hearing someone's intimate details of their life and you're like fully into them? I don't know. Or you feel connected to them in some sort of way. Like it happens. It wouldn't be a thing if it didn't happen. So just remember, by the grace of God, there go I. Any of us could be anybody. We're all capable. So just, you got to keep your guard up, because if you don't keep your guard up, you're going to get yourself in a situation. Okay. So as you, know, like you guys are in a program to work as therapists. And so we want to make sure that clients understand and everyone is clear on what your role is and where you're at in your training and all those things. So when we talked about limits of confidentiality, we want to make sure clients are aware that, one, you're a trainee. If you are still in school and haven't graduated yet, you are a trainee. Once you graduate, you become an associate, whether it's an associate MFT or an associate professional clinical counselor. Okay. So you are an associate. You are an associate until you pass your state boards and become licensed. Now, this can be a vast amount of years depending on where you're at in that journey and how many clients you see and all those things. But we want to make sure clients are clear in knowing where you're at and who you are. We never want to be misleading to clients. They need to understand what you're doing, where you're at, so there's never any miscommunication. Also, like, you are going to learn a lot of different things in your program, and some of you may choose to specialize in things based on trainings you do outside of your program. Don't false advertise yourself. Don't say you're trained in something when you're not. Okay. There's special trainings. Like, for example, I do EMDR, which is eye movement desensitization and reprocessing. You can't say you do EMDR unless you've gone through a training, okay, and have a specific certification. It's like that for emotional focused therapy. There's a few different ones where it's very specific. You don't want to mislead people and say you have some basic knowledge in something when you really don't. Now, overarching theory, understanding, technique, you guys all will get a basis knowledge of an overview of a lot of different things. Some of you might want to go specifically into one thing. You just want to make sure that you're not misinterpreting or misrepresenting yourself at all, because that's how people get in big trouble, and clients don't understand what they're getting themselves into, things of that nature. So just make sure that you know what you're saying and know it's truthful. We can't practice techniques on people without the proper training. So like I mentioned, the EMDR, you couldn't try to give that a whirl on someone and not have training, because that would be an ethical problem. Okay, so you want to make sure whatever you're saying or marketing yourself as, that it's accurate and true. We're not saying we're licensed and not being. We're not saying we're an associate and still in school. You want to be clear about that. A lot of times people are going to you maybe because you're a lower cost option. Maybe like you work for a nonprofit agency and that's all that they hire. So, you know, for a lot of people that may not make a difference. For very few it may. So don't be hesitant to tell people where you're at. Worst case scenario, they don't want to be seen by you. Okay, worst case. Best case scenario, it doesn't really make a difference, you know. Other than the fact you're in supervision, you'll be talking about your cases with other people, but that's okay. You know, that's part of the learning. Most professions like ours, like when you think of a doctor, when you think of probably dentistry, anyone that's like in any sort of medical type field, there's a level of residency, there's a time of learning before you're out on your own, and we're the same. And so we just want to make sure that we're marketing ourselves correctly, that we're advertising correctly, that we're making that clients know fully who we are and what we're up to, and they know what they're signing up for. Okay. Well, I hope you have a wonderful week. I look forward to looking over your discussion boards. If you have any further questions, just let me know.